Hello, everybody, and good morning. Andrea Twarowski here with Dentalelle Tutoring. So I work at a dental office once or twice a week, depending on the week, and things always happen where I get questions from patients or just something happens where I think, oh, well, that's a really good question. It's a good thing that I have so much experience, because if I was new at this, or if I didn't have a lot of experience, I might be thinking, oh, geez, I have no idea. I can't help you. And, we all have to start somewhere. So what I thought about doing is having a series of short, question answer types of videos. So if you guys ever have any questions, or if you want to know something, or if there's a topic that you want me to talk about, just let me know. I had somebody send me an email the other day where they said, what do I tell a patient who, they're either a new patient or their teeth have been sensitive for years? Is there a way that I can help them? Is there something additional that I can do in the office to help them? Is there a certain type of toothpaste out there that I can do to help them? Are there certain things that I can tell them that they shouldn't be doing, or shouldn't be eating, or shouldn't be drinking? And these things you learn with experience. These things you learn after having, talked to other patients of what works for them and what doesn't. There are also some patients out there who will say, well, I only use natural products. They're amazing, but there's also some out there that just simply aren't meant to be used inside the mouth. So yes, they're natural, there's no additional chemicals to them or whatever, but they really shouldn't be used inside the mouth. So sorry guys, I just have a message kind of pop up here. So what I want to talk to you guys in a short video today, and I'll try to keep track. And another message just popped up. Sorry, guys. I'll try to keep track of my time. So it's 9:22. So I won't spend too long, because you've all probably seen some of my videos where I do talk for 15 minutes, and then I was like, whoops, that was only supposed to be a 5-minute video. So what I want to do is talk about, I guess, a certain topic per video. So what I want to talk to you guys about today are those patients who come in and say that they have cold sensitive teeth. So I won't talk about if they have, hot sensitive teeth, if they're sensitive to pain, if they're sensitive to pressure, because that would be something completely different. And I'll talk about that another time. But I'm talking about specifically cold sensitive teeth. So you will have the question of, why do I have cold sensitive teeth? So you always have to start somewhere. So you need to look inside the mouth to see if they have any exposed root surfaces. If they do, that's why they have cold sensitive teeth, plain and simple. It could be 0.5 millimeter, it could be 1 millimeter, it could be 3 millimeters. Every little bit could mean that that's why they have cold sensitive teeth. But you will also have that, 13-year-olds come in and say, well, I can't eat ice cream because my teeth are too cold sensitive. That's normal. Now, no tooth likes the cold. The main thing is, though, is that after they eat anything cold or drink anything cold, does the pain last for 5-10 minutes? Or as soon as the cold is removed, does it go away? So you have to think about that also. If the pain lasts for 5 or 10 minutes, or even 2 minutes, that's not normal. So there might be something else happening. But I have lots of 10-year-olds, 13-year-olds who I look inside their mouth, their teeth look perfectly fine, but they insist they are extremely cold sensitive. So again, no tooth likes the cold. That's normal. If I ate ice cream, with my teeth, I would be cold sensitive too, but you're just not supposed to eat ice cream like that, if that makes sense. But if they insist that their teeth are extremely cold sensitive, always, always, always recommend Sensodyne toothpaste, which I'm hoping you've heard about it at this point. Sensodyne toothpaste is amazing. Honestly, it is. I don't work for Sensodyne. I don't sell for Sensodyne, but Sensodyne is amazing. But the key thing is, though, They have many different types of Sensodyne toothpaste out there. Like, there's tons. Have a look in the store, there's tons. They want either the newest Sensodyne, which is probably, you know, makes the most sense. There's a Sensodyne Rapid Relief. That one's awesome because obviously as the years go on, you know, newer things come out, newer, bigger, and better. But they have Sensodyne out there that, you know, says like Sensodyne plus whitening, Sensodyne plus this, Sensodyne plus that. Those aren't necessary, because another thing that you have to know is that anytime a toothpaste claims to be a whitening toothpaste, they add typically extra baking soda in there. And if there's extra in there, then that can make the teeth sensitive. Yes, so anytime a patient says to me, you know, well, my teeth are pretty sensitive, I will always say use Sensodyne, the newest type of Sensodyne. You know, there's no whitening added, nothing extra added except for the, you know, extra what am I trying to say, helps to protect the enamel, all to help against cold sensitivity. So, but also say they need to use it twice a day. There are some patients out there who say, well, I use Sensodyne in the morning, but then like a whitening toothpaste in the evening. They need to only use Sensodyne, because anytime they're adding on another toothpaste, the work of the Sensodyne is now not working, if that makes sense. So the ingredients in the Sensodyne toothpaste that have been now on the teeth are being taken away if you're using another toothpaste. So I always say to patients that, you know, if you don't want to be cold sensitive, you need to stick to Sensodyne. And why not? Yes, you may want to use other toothpaste, but then that's not helping your cold sensitivity. So if you are okay to have cold sensitive teeth, then you know what, sure, use whatever you want. But Sensodyne will not work, and it will not be effective if you don't use it at least twice a day, and that's the only toothpaste, okay? I have patients that are extremely cold sensitive, say on one tooth, two teeth maybe. Then tell them to put some Sensodyne on the tip of their finger, or a Q-tip, which I did have some here, and then say to rub it on the area that is sensitive and use that at night. So they want to brush and everything first, and then take some of the Sensodyne on their finger or a Q-tip, and to just sort of, you know, rub it on the areas that are the most sensitive every single night, and that will help them. Typically, depending on the patient, it takes at least a week though to be effective. So if the patient says, well, I used the toothpaste for a day, it didn't help me, so I just went back to something else. Well, no, it takes usually about 2 weeks to be effective. So tell the patients, be patient, but it will work. You know, be patient. It takes about 2 weeks. Use only Sensodyne every morning and every night. Use a soft toothbrush or a nice soft electric toothbrush, and then put it on in those certain areas if needed at nighttime. You will also have the patient say, well, I only brush in the morning. With Sensodyne, they need to be brushing twice a day, because then it's not going to be as effective. So does that make sense so far? So Sensodyne is the first thing that I will suggest. Plus, if their teeth are extremely sensitive, if they have a lot of root exposure, I suggest using the fluoride in the office every 6 months. You do not have to have them use it every 3 months, but every 6 months or even every 9 months would help them out a lot, because that helps to make the enamel, you know, a lot thicker, and their teeth won't be as cold sensitive, because it does actually help to heal the enamel in a sense. So if there's anything, I guess, wrong, or if there's any open areas in the enamel, that will help them. You could use a fluoride rinse or a varnish. I prefer to use the varnish because it has been shown to be more effective, but some offices just simply don't have that. But that's what I like to use. And with the varnish, make sure to tell the patients don't eat, drink, or brush for at least 4 to 6 hours, because you actually want that to be on the enamel a little longer. And it's normal after the varnish for the teeth to feel sticky and to look almost a chalky white, but that's normal, okay? So those are kind of the main things. They don't have to be using additional fluoride at home, but as long as you're able to give it to them in the office, it will help them. Some insurance companies don't cover it past a certain age, so let them know how much it is, but that it will help them, plain and simple. So yeah, so that's cold sensitivity. That's pretty much the main things that I wanted to let you guys know. Just always let the patients know that they have options. Now, if they have extreme root exposure, there is a thing that the dentist could do. Either the lesser invasive way, if that makes sense, is to dry the areas and put a primer and then a bond on top, and to cure that. So that actually helps to cover the exposed surfaces. It doesn't change, obviously, the color because the prime and the bond's a clear. But if they have, let's say their root is exposed so much that it's like a yellow-brown, then the patient might even want composite over top, so it looks a lot lighter, and that is okay too. But obviously, if you're adding composite, then you need to charge for that. So I've seen it where the dentist will add prime and bond if he doesn't feel the tooth needs a composite, but if the root is exposed in such a way where it's like dipped in a little bit, if that makes sense, and there's almost a notch there, so it's open but not a hole, if that makes sense, then he will want to add the prime, the bond, cure that, and then add composite over top, and then cure the composite. So that actually covers the entire area. But usually to add composite, you would have to have quite a root exposure of like 2 millimeters or more. But I've seen it done with less too. It can't hurt. It's just, it's a tricky area to, I guess, stay on. So it's common for the composite to come off over time. Like we have patients where, you know, like they are so cold sensitive, where we do put the composites on, like over here, you know, but they tend to come off every couple years or so. So we just, you know, we just add more. So that's an option too, but that's in more extreme root sensitivity cases, if that makes sense. So, okay, so we talked about Sensodyne, we talked about the fluoride varnish, we talked about the prime and bond over top, we talked about the composite over top too, if needed. So those, I'd say, are the main things if your patient has cold sensitivity. And let them know, though, it's normal for the tooth to not like the cold, but if they have a lot of root exposure, then that's why. And the best thing to do is to always tell them to use a soft toothbrush, because you don't want the root exposure to become worse. Because if they've been brushing too hard, perhaps, maybe that's how that happened in the first place, you don't want it to get worse. So you have to let them know you need to start with much lighter, because we don't want you to get more sensitive and we don't want it to get even worse. So, okay, guys, let me look at the time. So that wasn't too bad. Took about 10 minutes, I think. So I do hope that helped. Any questions, let me know, and I will see you guys in the next video.